Hands up! Don't shoot! Hands up!
In 2020, the country was in the midst of a reckoning between officers and those they serve.
You're gonna stay down. You're gonna stay down. Stay down.
Take this off my face.
No, I got it.
Deaths of people like Daniel Prude, who was in the midst of a mental health crisis, shined a light on police abuse and gaps in training. When police officers are expected to be ready, no matter the situation.
People are in crisis, and I didn't know how to handle them.
A new idea is taking hold across the country. The thinking is that officers shouldn't be the first on the scene, and in some cases, when it comes to mental illness, shouldn't be on the scene at all.
She's suicidal, doesn't want to go voluntarily. Do you have any information on her?
Officer Adam Beard and Andrea Hess are part of a co-responder unit in Prince William County, Virginia. Here, some officers are paired with mental health clinicians.
We want them to be as comfortable in the situation as we can possibly make them while still having safety in mind.
87% of the calls that they go on do not end in custody.
Heather Baxter oversees the region's implementation of a statewide initiative called Marcus Alert.
It's not just a police officer there to keep the safety under control, it's also the mental health clinician there to make sure that you get what it is that you need.
Named after Marcus David Peters, a biology teacher killed by Richmond police during what his family calls a mental health crisis, Marcus Alert goes beyond co-responders. There's the regional call center. When a call comes into dispatch, 911 operators decide the severity of the mental health emergency. Level 1 and 2 calls are sent to a regional crisis call center, who conduct additional assessments and offer physical and verbal support. No cops involved. For levels 3 or 4 calls,
if police are needed, our co-responder team would have a clinician there with them who can handle that.
You can sign up using the Smart 911 app.
There's also the county's usage of Smart 911, a nationwide app that allows users to create profiles, letting dispatch know of any medical history in the home.
You don't always remember everything that you need to tell the person on the phone. You're in crisis when you're calling.
1 in 4 fatal police shootings involve people with untreated severe mental illness, according to the Treatment Advocacy Center. And in 44 states, jails or prisons hold more mentally ill people than state psychiatric hospitals. One reason is the process. Having an officer bring a person to a healthcare facility is lengthy and requires admission from said facility.
The officers are physically there with them. They're watching them go through this. Some people are handcuffed to gurneys in hospitals, and we've had that up to 14 days.
Officers are sitting with people in the emergency room who need help, who need treatment, but there's a lack of bed space and nowhere for them to go.
Lisa Daly with the Treatment Advocacy Center says this can result in the one thing advocates hope to avoid.
You can kind of see how, from the perspective of law enforcement, it becomes very appealing to arrest that person instead of bringing them for a mental health evaluation, because you bring them to the jail, you drop them off, you're back out on the street.
We're tasked with this very hard decision of there's nowhere for them to go, but we can't let them go home. And it for anyone who got into this business because you wanted to help people, this is a very frustrating time.
Daly says the national bed shortage is one of the systemic mental health issues caused by a lack of funding.
This population that has been inappropriately criminalized, you can't actually push it back into the behavioral health system until you have a system.
Ideally, that would be getting people help before a crisis. Baxter says that's the goal.
So the hope is it gets stopped at dispatch and never even goes out to police if that's the thing. And then also giving police a tool other than putting someone in their car and driving them to a hospital.
Amber Strong, Newsy in Prince William County, Virginia.